Okay, so now I'm going to look at dissecting a little bit of the leg muscle. Okay, so again, at this point I can't see anything because it's covered in that loose adipose connective tissue. All that fat tissue. Anytime you see that yellow stuff, that's all fat. And so the first thing I want to do is I like to use my forceps and I just sort of peel that back. You can also use your fine scissors and do what's called stick and spread. So you stick it in and then you just sort of open it up, and that's going to get rid of a lot of the fat because fat is much softer than the muscle is going to be. Okay, so again, no cutting, just spreading. Okay, I'll take off all the fat, and then once you get enough of the fat and the fascia, which is the name of the connective tissue that surrounds that outside of the muscle, once you get all that fascia removed, then you're going to start to see the boundaries of the muscles. Okay, so see how I just sort of exposed this one? This is the sartorius muscle here. And so remember, it's not just about cleaning the surface, you also need to separate it. So I like to use my forceps, but if you want, you can also use the blunt probe. Just sort of get under there and start breaking the connective tissue surrounding it. Now be careful in this region right in here. This is called the femoral triangle, and it's got a lot of good structures in there. It's got the femoral artery, the femoral vein, and nerves. Okay, and also some very small little muscles in there. And so what I like to do is, instead of taking the forceps and poking at it like this, you hold it sort of horizontally and do just little small picks, little tiny like brushes sort of. Okay, so don't gouge it, especially these fine forceps, they're really pokey. So you want to make sure that you just sort of scrape it, almost like scraping the edge of the muscle. Okay, and so you start to see how the boundaries of the muscles, and again, these are very, very thin muscles. Okay, so you don't want to go too deep with them. You're peeling them off of each other, you're not cutting them. Okay, here's the gracilis. Mine is a male. Okay, so horizontal, just sort of scraping the surface of it off. I find that once you get far enough on one side, it kind of helps to stop going from that side and sort of find the other side and kind of go up to meet it. Now, for the back of the leg, right where the popliteal region, where your knee pit, there's going to be a whole bunch of fat in there, but there's also some really kind of nice looking nerves and blood vessels, so you want to try to keep those if you can. So don't use a lot of force here. You want to try to go slow and be very methodical about getting out the structure. So you want to get just the fat but none of the good stuff out. Okay. So I'm looking for the other side of my gracilis muscle, but I can't see it quite yet because there's still a lot of fat here. So I'm going to switch to my blunt probe. Oh, there it is. Okay, I need to do a little bit of stick and spread. Okay, stick, and then open it up, stick and spread. Stick and spread's a good thing to use when you've got a big clump of fat that you need to get rid of. It's also good for prying thin muscles off of other muscles. Okay, do you see what I'm doing? Kind of got it at an angle. This is the edge of it, and I'm just opening it up. No cutting involved, just opening it up. And now I'm all the way through now, and now I just need to try to go from origin all the way to insertion. Try to get it off of those hamstrings, semitendinosus and semimembranosus. Tend to be kind of stuck on. Okay, now for most of the time you're not going to be cutting muscles, okay? Almost no cutting of the muscles. Only cut muscles if my PowerPoint slides tell you to do so. And for the gracilis muscle, we're going to need to reflect it. Here's the gracilis muscle. We're going to need to reflect that guy back. And so when it says to reflect it, okay, no transecting. I don't like it when you cut the middle of the muscle because then you don't have much to look at. And so instead what you want to do is reflect it, which means cut along the edge, and you're going to want to cut along the edge that the insertion is on, not the origin. And so cut along the edge of that muscle, and that's going to allow you to peel this superficial muscle up, and that'll let you look at the deeper muscles there. Okay, but don't reflect it until you find the boundary. Mine's not quite clean enough to do that. So I gotta peel, peel, peel. Okay, so see this red? So this red line here, that is a blood vessel. Try not to cut those. And this white one that looks like dental floss, that is a nerve. Try not to cut those either. Just leave them in place, sort of work around them. Mine needs a little cleaning on the surface, so again, don't poke it. Hold it horizontally. Tore my muscle a little bit. Okay, and now I have the gracilis muscle from the origin. Well, actually, not quite. Need a little bit more. From the origin all the way to the insertion. Okay, so I can stick my blunt probe all the way from here along the full path. See that? Okay, so now what we need to do is, in order to see the muscles underneath it, now I'm going to reflect it. And again, do not cut it unless I specifically tell you to do so in one of my PowerPoints. Okay? So for this one here, I'm going to trim just the insertion side. Try not to cut the blood vessels. And that's going to reflect that upwards, and that'll allow you to see those adductor muscles here. Okay, so again, this is the gracilis. You got all these adductor muscles. There's the pectineus in there. And it'll allow you easier access for the hamstring muscles over here. Okay, so semimembranosus, semitendinosus.